Hello everyone, and welcome back to my show. I'm Dr. Lott from Acupuncture is My Life. Now in today's episode, I'd like to discuss headache as one of the CDC's 11 symptoms of the coronavirus. The classic definition of a headache is a painful sensation in any part of the head, ranging from sharp to dull, that can accompany other symptoms. Now, headache has been determined to be one of the main symptoms of COVID-19, whereas I'm noticing individuals who've experienced less frequent bouts with headaches in their lifetime are now experiencing more of them and are concerned as to if they've been affected with this virus. Now, some individuals have contacted me expressing a subjective feeling of a migraine headache. I would inform them that headaches brought on by the coronavirus tends to present different than that of a migraine. A headache brought on by the coronavirus tends to present as like really tight with a squeezing sensation to it, and it usually worsens when there's cough and fever. Now, this sensation tends to occur as a result of your immune system reacting to this virus via its actions of releasing chemical cytokines in which the cerebral cortex of the brain perceives as pain. So when it comes to the coronavirus, the more severe headaches tend to occur in individuals who are very sick with this virus. Those whose lungs have been severely impacted tend to show more complex neurological complications. Now, findings from observational studies are showing that the onset of headaches can occur during pre-symptomatic phase or symptomatic phase itself of this infection. There are known cases where headache as a symptom of the coronavirus have persisted long after all other symptoms have been resolved. So if you feel you've been infected by this virus, I recommend you contact your physician to get tested. And while under the care of your physician, attempt to contact your local acupuncturist for additional care regarding your symptoms. As usual, I've been asked by some, how is headache diagnosed and treated in Chinese medicine? Now, in Chinese medicine, the head is the area where all the yang channels meet. So pain in the form of headaches tend to occur as a result of yang being obstructed, or there's a lack of qi, blood, or essence as nourishment is deficient. Now, headache in Chinese medicine can be as a result of exterior pathogenic factors or interior organ dysfunctions. Since we're on the topic of the coronavirus, I'll stick to headaches as an exterior pathogenic factor. Now, headaches in Chinese medicine are usually tied to internal wind as a result of exterior wind being the main pathogenic factor. The upper part of an individual's body is usually the first area to be attacked by external wind. Wind pathogen in Chinese medicine tends to carry other pathogens with it when it invades the body. So for example, like wind cold tends to coagulate qi in blood and obstructs the channels and collaterals. Now, wind heat tends to go upwards to the head and disturb the orifices, and wind damp tends to disrupt the flow of qi, especially yang qi obstructing the ascension of yang. Now, there are three basic patterns for headache as an exterior pathogenic factor in Chinese medicine. Now, one is wind cold headache, where there would be a headache with pain that radiates to the neck and back and tends to become aggravated when it's windy outside. Symptoms would present as aversion to wind or aversion to cold or both. The tongue would appear with a thin white coating and the pulse would be tight. Now in this case, I would just simply look to expel wind cold. Another pattern could be wind heat headache, where one would experience like a distending headache in which they would subjectively classify as a splitting headache. Symptoms would present as aversion to wind with fever and red eyes and a desire to only drink cold beverages. And it'd also be accompanied with a sore throat as well. Now the tongue in this case would appear as dry and red with a yellow coating, and the pulse would be very rapid. In this case, I would clear internal heat and disperse internal wind. Now another pattern could be wind dampness headache, where there would be a sense of heaviness. Now this type of headache would tend to be aggravated, like let's say by rainy or gray weather. Symptoms would present as a heavy feeling of the extremities, a congested sensation in the chest, poor appetite with irregular bowel movements. The tongue would appear as having a greasy white coating. Now, in this case, I would clear dampness and expel internal wind. Now, if the headache appears as stubborn and may linger for several months, I would include herbs that would invigorate the blood and unblock the channels within the body, because headaches that tend to linger long after symptoms have resolved itself tends to be a sign in Chinese medicine of deep obstruction within the collaterals, whereby herbs are generally needed to assist acupuncture. Now, in my next episode, I will discuss vomiting as one of the CDC's 11 symptoms of coronavirus. Now, don't forget to subscribe to my show. And until next time, acupuncture is my life. What's yours?